And welcome back to part 3 of your Introduction to Pediatric Nursing. Okay, so chapter 39. I think this is the last chapter that I assigned you for this week. I need you guys to review and read the whole chapter. There is really good stuff that will make your life as a pediatric nurse way easier. I'm not lying. It will just be good if you would just read it. I hope you take time to read it. That's all I'm going to say. And it's time for everybody's favorite topic, informed consent. Yay! What do we need consent for? Well, major surgery, minor surgery, diagnostic tests with an element of risk, i.e. lumbar puncture, bone marrow aspiration, cardiac catheterization, bronchoscopy, just to name a few. You also need consent for treatments with an element of risk. That includes blood transfusions, thoracentesis, paracentesis, just to name a few. We also need consent to take photographs, for signing out a child AMA, for autopsies, except in the cases of SID or unexplained death or probable foul play. Then you don't have to have informed consent for an autopsy. And you also have to have informed consent for a release of medical information, or usually hospitals just have a special form. As far as who can give consent, that is a little different in peds versus adult medicine. As long as the child is under 18, they are a minor, and consent must be given by a parent or legal guardian. If the parents are married, consent can be obtained by just one of them. If they are divorced, then consent is given by the one with legal custody. Parents have the right to withdraw their consent later too. If parents are unavailable, consent may be granted by phone in the presence of two witnesses. So, if you are the primary nurse for a patient and you get phone consent, then you hand the phone to your fellow handy nurse who also verifies the consent. You both sign the consent form that you spoke with the parent by phone to obtain consent. And then as soon as the parents are able to get to the hospital, then you would have them sign the real consent form. Mature and emancipated minors. In cases such as pregnancy, marriage, high school graduation, independent living, or military service, there is the emancipated minor case. Say you have a 15-year-old pregnant teenager. She can now sign her own consent forms and make her own medical decisions. You can treat a child in an emergency situation without any consent. You want to try and obtain it, and you need to document your attempts to obtain it, but you wouldn't withhold treatment in an emergency situation just because you couldn't track down the parents. Did you know that for certain things like STDs, mental health services, alcohol and drug dependency, pregnancy, and contraception, teens can get access to this without parental consent? These are, quote, medically emancipated conditions. Don't ask a child if you can look in their ears or ask them if they want to take their medicine. The answer 9 times out of 10 will be no. Tell them what you are going to do and then do it. You can use distractions such as iPads. You can have them blow bubbles, sing to them, read a story to them, things like that. Those are all good sources of distraction. It's important to provide positive reinforcement. You can, as the nurse, you can say, "I like the way you held still while I put the IV in. You were so brave." That's great. It's important to allow the child to express their feelings. Let them cry when you're putting the IV in. It hurts. Who cares if they cry? Let them scream. I would scream too, except, we're all adults now and we have self-control. It's okay for kids to express their feelings. That's all right. I want you guys to start, there's box 39-1 on page 1137. It's fun ways that you can get the job done. Say, for example, you have a dehydrated child, or not even dehydrated, but you need the child to start, you need to start pushing PO fluids. Well, what if it's a little girl and she says, "I don't want to drink"? Bring in cups and say, "Okay, let's have a tea party." Bring in some dolls. Let's have a tea party. Little girls love to have tea parties. Use a crazy straw or a special cup. Read a book together. And then every time you turn the page, the child has to take a sip of fluids. Make a progress poster that kids can fill in. Every time they drink another cup of fluid, you go over and they scribble in and they fill in, they color in some more of their progress goal. Say you have a child who's post-op, who needs to do, the cough and deep breathing to help prevent pneumonia. The kids don't want to do that, so what can you do? Have them blow bubbles. What does that make them do? Take a big deep breath, and then they blow bubbles. That's deep breathing, right? You can paint a little girl's fingernails and have her blow them dry. You can do straw blowing painting, which I don't know if you guys have ever done this, but you put little drops of paint on there and then you blow through a straw and it, it makes the paint real streaky on paper. Again, this is why you have childlike people to help you. You can play minute to win it with a straw and a cup and some other kind of little object. M&Ms work great. These are fun ways that pediatric nurses get to think up of ways to get the job done. You're actually getting the child to do what you need them to do. You're just, quote, tricking them into thinking it's a game as opposed to just, being bossy with them like you would with an adult. We weigh children on a daily basis because that is everything in pediatrics is weight-based. Fluid replacement, doses of medication, fluid and electrolyte balance, all that stuff has to be done on a daily basis. We're going to check temperature. If fever is anything greater than 100.4, oral or rectal temps are preferred. Tympanic in children are not always accurate. Heart rate, very labile in kids. Heart rate is very sensitive to the effects of illness, exercise, medication, pain, and emotions. So good luck. That's my only advice. Respirations, make sure you count respirations for a full minute. Same thing with their heart rate. Listen for a full minute. You should also know that sometimes when kids get sick and have a fever, they can have a transient murmur that will appear. Just keep an eye on it. Just monitor it. As far as blood pressure goes, make sure you're using a proper cuff size. And pulse oximetry, that's like the one thing that children are usually not afraid of because it doesn't hurt at all once they figure that out. And I just want you to review table 39-3 on page 1139 here. How many of you have dealt with toddlers who say, "No, I do it"? Yes, you do it. And it will take us like 4 times as long that you have to put your own shoes on. When I could just put your shoes on and we could be out the door, right? We've all experienced this. For toddlers ages 1 to 3, autonomy is a big deal. They have about a 300-word vocabulary. How are you going to look in their throat if they won't open their mouth? You got to trick them. Ask them to open their mouth and pant like a doggy. Actually, it works better if you ask them to look in their mouth and they say no, then say, "All right, fine." Pretend like you don't care and skip it and go on and assess something else and then go back and say, "You know what? Can you open your mouth and pant like a doggy?" And then kind of show them. And little kids are so gullible, they'll do it. So that's a good option. Or you can try turning them upside down. And oftentimes when you hold a kid upside down, generally will open their mouth. That's another good way to do it. Although, so I heart little preschoolers because they have a 900-word vocabulary and they like to use it. Preschoolers may talk incessantly. You can read through the rest of the stuff on your slides to kind of figure out where they're at developmentally. Just be very careful. They are very concrete thinkers. If you say something like, "It's a zoo up here," they literally think that there is a zoo on the same floor that they are at the hospital. So you got to be really careful what you say. If you say, "It's crazy up here," they really think it's like something is really crazy. If you say, "It's bananas up here today," they're going to look around and be like, "Where are the bananas?" That's hilarious. They're concrete thinkers. School agers, I don't really have anything extra to add besides what's on your slide. And adolescents. Whew, what to say about adolescence? So much that we don't even have time for it on this PowerPoint. All right, the teenage brain. This is some really good stuff I got at a nursing conference. This is not in your book, but this is good stuff for you guys to know and to understand. The teenage brain consists of the prefrontal cortex, the motor association area, the motor cortex, and Broca's area, which is, of course, voluntary speech and communication. The last areas are pretty well developed in early adolescence. However, the prefrontal cortex and the association areas are immature in teenagers, and they continue to develop until they are in their early 20s. Not 18, 20s. Everybody hear that? 20s. So the prefrontal cortex is basically your center for judgment, insight, reasoning, organization, future planning, and problem solving. And it has extensive connections with the emotional and instinctual centers of the limbic system, especially the amygdala. These levels are critical for emotional learning and high-level self-regulation. This is the pathway that is immature in the adolescent brain. Is this any surprise? Not really, because don't we know that teenagers lack good judgment, they lack insight, they're very difficult to reason with, they are not good about planning ahead for the future, and sometimes they do lack problem-solving skills. So yeah, it's not a big shocker here at all. Simply put, the prefrontal cortex of the brain is like your mother or your father, regulating behavior. Parents who act like parents do this for their teenagers. Parents who act like teenagers themselves and want to be all buddy-buddy friends with their kids do not. The prefrontal cortex puts checks and balances on behavior, especially on the amygdala. The amygdala is sort of like the wild beast from within. It's the instinctual nucleus of the brain. The pathways continue to develop, gradually improving the precision and the efficiency of normal communication, which is completed by the early 20s. 20s! Especially a large bundle connecting the two hemispheres with the limbic system, the corpus callosum. And the pathways connecting the prefrontal cortex and the limbic system. Now, there is a disconnect between the two because the limbic areas of the teenage brain mature earlier and faster than the prefrontal cortex. It can be difficult to interrupt an action that's underway for kids because of this. Think about this disconnect. Again, I'm going to say it again. The limbic areas mature earlier than the prefrontal cortex, which is responsible for judgment. So emotions mature faster than judgment. Fantastic. Here's a great example. Okay, so if a teenager is in a car, if the teenager is driving in a car, they rear end the car in front of them. For example, the teenager freezes and screams. That's the limbic system. That's the emotions. Ah! Versus an adult who will brake hard and steer out of the way because they have a mature prefrontal cortex. Teenagers have a mature limbic system, but not a prefrontal cortex. Does that make sense? This makes it very difficult for teens to think before acting because they don't. They don't think before they act at all. Adolescents find it more difficult to choose between safer and riskier alternatives, and they have difficulty resisting peer pressure. Again, it's that prefrontal cortex again. They're using it somewhat, but it's overtaxed, and you throw in peer pressure and "Aw, come on, just once." That stressful situation on an already overtaxed prefrontal lobe, it may just give way to better judgment. All right, so switching gears a little bit here to talk about child abuse. That's a great quote on there. The skin and bones tell a story that the child is either too young or too frightened to tell. It's important to know what normal bruises and normal scratches are. It's important to know where normal things are. Again, bruises on the forehead, completely normal for a toddler because what do? They tip over, they fall over, they bang their head all the time. They have their knees, their shins, sometimes their chins. Those are all very normal places for toddlers to have injuries. Where is it not normal for children to have injuries? Their back, on their trunk. They shouldn't have circular bruises around their arms. They shouldn't have bruising around their neck. Also, pay attention to the age and the progression of bruises that's listed on your slide. Another possible sign of child abuse would be bites. We always think, bruises and broken bones, but bites. Um, did the bites come from another child? Did the bites come from an adult? Did the bites come from an animal? Parents who don't protect their children from animals, that is considered child abuse. I took care of some when I was in nursing school, and I took care of a mom who was in the hospital for an extended period of time for preterm labor. She delivered a set of twins, and of course premature. They went home from the hospital, and about a year later, maybe less than a year later, about 6 to 9 months later, I saw her flash upon the news because she had a party at her house, and she strapped her babies into their car seats, and she put them upstairs in the attic of her home where rats attacked and ate them while she had her party downstairs in her home. That is child abuse. Another sign, be aware of what the child says and what they don't say. Follow your gut instinct. All of us are nurses. We're smart. If we would all follow our gut instinct, we'd be even smarter. Look for children who look at their parent before speaking. Also consider the home environment. If a step-parent or a live-in boyfriend is around, the likelihood of abuse is greatly increased. And I'm not trying to pick on guys here. I'm just simply stating facts. A child living with a step-parent is 100 times as likely to suffer fatal abuse. And that quote comes from The Truth About Cinderella, A Darwinian View of Parental Love, in 1999. I put the citation in the notes section of this slide. Be aware that you guys are mandated reporters. You guys have all sat through mandated reporter training at the end of the 235 course for the seated students. So I know you guys have had the exact same training that they have, and this is one of the reasons why it's so important. Follow your institution policy. All right, so the rest of chapter 39 just talks about how to collect specimens from children, like blood, urine, poo, how to place NGs, how to give shots, how to give oral medicine, how to instill eye and ear drops, how to position children for an LP, for lab draw, for shots, for central lines, for oxygen therapy, vents, trachs, suctioning, chest tubes, gavage feeds, G-tubes, and ostomies. Whew! I'm not going to go over all this with you because I think you guys already know it. But you might skim through the book, and if there is a procedure or a process that you are unfamiliar with, you should definitely brush up on it. And this concludes the introduction to your pediatric course. Thanks for listening. I hope you weren't too bored.